Pinworms, we'll begin with the pinworms. They prefer to live in the large intestine, the small intestine. There's like least amount of species that crawl out of the rectum during night. The pinworm is one of them, and only female does that when it sheds the eggs and then crawls back in. Other worms do not crawl any close to the rectum, and this connected with the fact that there's like least amount of nutrients there. The nutrients are mainly inside of the large intestine and the small intestine. This is actually the best place where the nutrients are after our digestion. They're broken to the needed consistency, and this is where parasites can easily feed on the nutrients that we've kind of pre-digested for them. All right, so let's go into overview of parasites. We'll talk about the roundworms first. The first one is the pinworm. Pinworm is largely spread type of the roundworm, affecting children mostly, but of course adults too, but in adults it's less conspicuous. However, children suffer that greatly. And the way that contamination happens is from person to person. This is one of the rarest parasites that can contaminate directly from person to person, also through the eggs. So once those eggs are shed during the night, especially it happens in the dawn hours, where the person is fully, like deeply sleeping and the sphincter of anus is relaxed, a female crawls out and sheds the eggs and then crawls back. Once the individual wakes up in the morning, it could be child, they of course scratch that area because it's very itchy, and itchiness spreads the eggs. So having touched the eggs, child will spread the eggs to other areas. They may directly take that in their mouth. They could put those eggs on the food and everywhere else, and everybody would eat that and get contaminated with the pinworm. Then the pinworm gets the digestive tract and grows into larvae. And the larva stage happens for about 21 days. Within 4 to 6 hours, the egg is already viable in terms that it can infest up to 300,000 eggs that the female can shed, and they can live in our system from 3 to 5 years, which is a significantly long time considering small creature like the pinworm. Their size is usually about ½ inch, which is a pretty small one. They have very distinct head that looks like a pin. That's where they get their name from. And in some areas, they're also called threadworm. They have two scientific names, but it's the same worm. Symptoms are very severe intoxication that can happen because sometimes children can host up to a whole pound, even up to 2 pounds of those worms inside their body. And if the parasites are dying, they can cause severe toxic manifestation in the body with the poor appetite, nausea. It could be either diarrhea or it could be constipation. And then children take that to their daycare. Other people get infected inside their families, and so the parasite spreads fairly quickly. Pinworm does not feed on the blood. It only feeds on the semi-liquid nutrients that we have in our digestive tract, depriving us of the nutrients almost completely. Now, the next one is the Askari. Askari is a more severe parasite, and it's also a big concern. It grows up to 40 centimeters long, from 20 to 40 centimeters long. It has two genders because some parasites, they are hermaphrodites. That means that there's no established gender. They can actually switch their genders like snails do, but these do have the genders. The male is shorter than the female, and they get to crawl within the entire body. So entire body is their house, and especially they do it in the larva stage. Ascaris are usually red in color, and that means they're sucking blood. If the Askari is red, that means it's not hungry. But if it is pink, then it means that it is hungry or sick. Sick specimens, they just, when they're dying, they're weak, they cannot flow anymore, and they just come out with a stool like semi-viable, but almost like dead. And then the individual can see the infestation because they're coming out with the stool. And that means that this worm's infestation is high and the worms are already dying. So, but there's also another, and we'll talk about that now, that is Toxocara. Toxocara is the dog Askari or canine Askari, which has very distinct white color. Sometimes people may confuse these two, but the color of the parasite is the identifier. Ascaris, they migrate throughout the body. They produce up to 500,000 eggs. That's how many the female can shed at once. And again, their cycle is about same, about 3 weeks. And for most of like roundworms and other parasites, the larva cycle can take up to 21 days. And this is why past 21 days, they can be reinfestation, and people, when they think that they've gotten rid of the parasites, they can reinfest in about 21 days. They can live inside our body and the intestinal tract for about 2 years, sometimes even higher, up to 5 years. Fertilization with manure that can actually carry Ascari's eggs and contaminate the crops, have the eggs spread on the vegetables and berries and fruit. They can actually be present not only on the vegetables and fruit, but on the hands of people who are dealing with manure. They also do the encapsulation. They penetrate into, once the egg inside the digestive tract, it actually gets into the stomach wall and makes its way into the lung, for example. That's where it likes to go through the larva stage. Larva grows inside the lung, causes no symptomology initially, but then as it grows and starts being active, then it produces the respiratory symptomology, the cough and sputum, and all of a sudden the eruption may happen that is accompanied with a huge allergic reaction initially and like severe respiratory manifestation, but then it all goes away and the Askari larva is making its way into the intestinal tract where it grows to the adult size and just lives there up to 5 years. And of course, we also need to consider and remember that parasites, they're trying to, this is their adaptation method, evolutionary designed, that they're trying to conceal their presence by all means possible. They're disguising as much as possible. They cannot make their host feel really down so that the host doesn't identify that it's parasites and then take necessary measures. They are always kind of on the brink of feeling okay and not feeling okay, but sustainable and can go on like that. And at the same time, not being able to identify the causative factor. So this is what they have adopted millions of years of evolution to do. So we need to really be cautious of that and always consider that when parasites come and invade, they would do anything possible for us not to notice their presence. So any signs and symptoms that appear is the ultimate manifestation of the parasitic presence, because otherwise parasites are very low profile, designed so that nobody can track them down. One individual parasite can suck up to about a whole ounce of blood a day, up to maybe even 2 ounces. The bigger specimens are the ones that almost like 2 feet long. They would actually suck a lot of blood. And just by doing that, imagine how much of the blood loss we sustain on a daily basis. And it could be up to 100, even sometimes even more of those specimens inside of the intestinal tract of an individual, making it like a huge blood loss in a day, up to almost like a pint or even more of the blood a day. And of course, yes, that leads to anemia and leads to other malnutrition and other conditions, and then people just don't understand where's my anemia come from, and doctors, without giving it a second thought, they just give people different medications and tell them to eat even more meat and more liver, which is like really not the point. It's actually even damaging, that can actually sustain the parasite even further. And because in the animal products, number one, there's hardly any vitamin B12, which is like not even the concern at this point, but there's hardly any sustainable proteins or enzymes or vitamins, because it's denatured, it's cooked, all nutrients are annihilated in that food, and they give them antibiotics. That is not really helping. Point is that the anemia and the blood deficiency comes from parasitic invasion. People just don't get that. They don't know. Doctors don't know. They give them the course after course of iron. They give them iron, the iron drops, and they give them iron again. That never ends. And no matter how much that they take, it's just not sustainable. And the supplements, people think that they need to take supplements, and we do need to take supplements because one thing is the parasites, but really our crops are nutritional deficient because of the cultural methods, of course. We just have the pandemic of nutrient deficiency and pandemic of parasites. Now put them two together, there's like hardly any favorable condition for a human in this scenario. But nevertheless, we need to be concerned with how we provide nutrients to our body, and that is either with food, and we need to supplement the food nowadays. Of course, how not to supplement, we do need to do that. And if we do supplement, most of these nutrients would actually go towards feeding the parasites, and we get into this vicious circle we cannot break through, and nobody around seemed to be able to help. Now, if you ask the doctors, medical professionals, they will tell you that there's, of course, a concern with parasites, but it's not a huge one. Not many really understand the depth of this problem and the concern that it brings. It's basically the fundamental problem with health. It's because of the poor nutrition. Yes, it is the way that we can digest food. All the parasitic invasion actually begins with the concern of our digestion. That means that we began eating inappropriate foods, and that way we made our digestive tract weak. It allows penetration of the parasites into the system because the digestive tract is the filter number one. It is the gateway of everything that comes from the external environment, especially with food. And food is the main concern with even the parasites. If the food is contaminated, but if our digestion is strong enough, it can still filter the parasites out, can still annihilate and kill the larvae and eggs right there at the stage number one of the system inside our stomach juice that is concentrated with hydrochloric acid, which is supposed to break any protein down, meaning any egg and larva should be affected by our digestive juice, but they don't. How come? Because we've made our digestion very weak by introducing improper combinations, by drinking water during when we eat. Thus, we are making the concentration of hydrochloric acid low, and we fail to break down the proteins, and not only the proteins of the eggs of the parasites, but proteins of our own nutrients. We hardly break the nutrients down to the basic components that are needed, and therefore that larva can survive the digestive juice. The eggs can survive that and get inside the system and start spreading. As well as there's some species of parasites that are specifically designed to go through the digestive tract of the mammal, especially the wildlife, like bears, for example. They get parasites too. How come that their digestive tract is not working? No, it's working definitely better than ours because they're still inside the ecosystem. They're not outside the ecosystem and living in the artificial environment like we do, because we've created the artificial environment to live in. Parasites that are designed to go through the digestive tract, they're basically being released from their capsule. So the few outer layers are supposed to actually be digested by the animal, and then the larva is freed up or hatches, and it crawls into the organ systems where it dwells until it reaches the adult size, and then it makes its way back into the digestive tract where the adult stage begins. So this is the cycle of most parasites, especially with this Askari parasite, the roundworm. So at the preventative level, we advise to do this program once or twice a year. But on the therapeutic level, we recommend doing it by the individual protocol, knowing which parasites actually is invading. All right, so that's the Askari. We go on, and this is the Toxocara, which is the canine Askari, which looks pretty much the same, except for that it has a little split at the head. Look at its head. This is how it looks. The length of it is about 10 to 15 centimeters. So it's slightly smaller than Askari, and it looks white. It's always white. It's not pink or red. And it does pretty much the same thing that the Askari does. Once the eggs are shed and they get into the intermediate host, which can be anything from the rodents to birds. They actually get inside either our system or inside our pets system, and this is when they begin their larva stage, which is also dangerous phase and can contaminate during that phase, and that gets developed inside the lung as well. It takes the same cycle of 3 weeks for the larva stage. Toxocara travels in different organs, not specifically that it likes the respiratory system. It mostly likes bottom of the eye with the beta carotene, and it likes the brain. This is where it actually goes. Then it also has different manifestation of the larva stage that can be either the neurological stage, it can be respiratory stage, it can be the liver stage, and each stage of the larva development, depending on the dislocation of this larva, will trigger the specific symptomology. The neurological symptoms, the brain fog, the mental flares, and that's like the least of concerns probably, but severe headaches, nausea, vomiting, the symptoms of the tumor growing inside the brain, that can even cause the paralysis. In the external environment, it's easy to get infected with it. It affects, for example, the children. If things like biliary duct dyskinesia happens, right, where there's poor bile flow, or the asthmatic symptomology, respiratory signs, some severe allergies. The cases with kids would be most likely there could be the parasites, because kids have not yet been able to develop, because they're kids and there should not be blocked bile ducts, of course, for whatever reason, because it's just a kid. They have like brand new system. And if that happens, the indication is that there's parasites blocking it. That's the first thing that needs to come to mind. But however, we see the doctors start treating cholecystitis like as if kids are adults, with even hormonal therapies. If you get to the doctor who gives you these instructions without checking for parasites first, like I mentioned before, number one thing is to change the doctor and investigate for parasites. Way to investigate and establish the correct condition through the coprological, and coprological meaning the testing of the fecal matter stool is very vague and needs to be repetitive. Another thing is that it's not all the time, because the cycles don't happen every day. The cycles happen every 21 days. So even 3 times collecting stool samples may not even show the parasites. And then after having done it 3 times, the parasites are ruled out, but it's not the correct way of doing that. So the most reliable tests are for the presence of antigen. And those are the immune tests that actually check for the presence of the gene in the blood of the different parasitic invasions. With one test, you can check a lot of parasites and the presence, and they can actually show you the parasites that are not only present in the system right now, but were present in the system before too, because some traces linger inside of our body for pretty significant long time. Okay, so they shed in numerous amount of eggs, up to like 500,000, 250,000 eggs. They do pretty much the same way that Askari do, roundworms. So preventative measures are always important. Always consider personal hygiene, hand washing, and rule of thumb is nothing goes inside the mouth. No fingers, nothing other than the food, other than what you eat, the clean spoon, clean fork, 100% clean, and the food that you are 100% certain has no parasites. That means that food that has been thermally processed, meaning cooked. Actually, this is another point I wanted to mention, is that the cooked food actually pose less danger than the raw food in many cases, because as you see that some of the eggs that are shed on the soil can stick to the vegetables and fruit, and if we don't wash them thoroughly enough, using the correct washing methods, but just rinsing under the cold water, that may not produce the good effect eliminating the eggs of the produce. But we need to take additional measures like soaking the produce before we wash them, rinse that in the 5% vinegar, for example. This is a good method. Or using the ozonizers. This is a wide range of the devices that make the ozone, which can also be used in the water as the bubbling gas inside the water, and you just dip your vegetables and fruit in that water and put the ozonizer for some 20, 30 minutes, and that actually does miracle. The ozone breaks down the membrane of the eggs and annihilates the eggs of the vegetable, and only then you rinse the vegetables and then you chop and cut them and have them raw. So that's the best way to do. Or if you cook your food, then most likely you are removing the eggs and larvae, you're killing it, but some larvae, especially the tapeworms, can sustain some high temperatures as well inside their capsule, and they can still survive the thermal processing as well. So be very aware of that and make sure that you're processing the animal products if you use them very thoroughly, and no medium rare steaks and things like that. Or sushi can also be potentially very dangerous, and only knowing that product is clean, only then would suggest you take it with a peace of mind. Otherwise, be very concerned with it and make sure that you follow the personal hygiene and hand washing routines, steps. All right, so, but yes, this is in the field of common knowledge, notion, and everybody is aware of that. It's just not everybody is using and practicing it, and the reasons are different. However, everybody knows about it. But now that people start understanding the extent of the seriousness of the situation, I hope they can start taking additional measures in preventing these causative factors. All right, next is the whipworm, trichuria. This is what it's called. The whipworm is a roundworm. Females are usually larger than males. They can reach up to 55 millimeters, which is about a fifth of an inch. Males are even smaller than that. Sometimes when the female has eggs, it can expand to about double size or so before it sheds the eggs. And then contamination happens through food, dirty vegetable and fruit, same way with through dirty hands. Everything that we've discussed about the Askari and Toxocara is pretty much the same with the whipworm. Eggs can be carried with flies, with the insects, roaches, cockroaches. We take measures here too. It lives in the lower part of the small intestine, and it actually bites on the mucous membrane. Here is a good place for the parasite to bite the membrane, because the membrane here is very thin and easy to penetrate through, bite through, very tender, and is rich with the blood. So this is a good place for parasites to live and produce their negative effect. The biggest concern with this parasite is that it can cause appendicitis. Contamination is accompanied with bacterial infections and can cause the prolapse of the rectum. That's very indicative. If you see the prolapse of the rectum, this parasite is present. The female sheds about 3,000 eggs a day, and that are carried with feces out, and they go into the same contamination pathway as the any other roundworms would do. Then within 1 month, the larva becomes an adult specimen, and it can live inside the body up to about 7 years. Imagine the parasite living in the body for 7 years with hardly with any trace. Of course, the person will feel the effect of it, energy levels. We only think that we are not affected, and please don't think that you are not affected. Everybody is affected. We all live like semi-sick when we think we're healthy. I'm not even talking about people who say, oh, you know what, I'm not feeling well. I'm sluggish and I have like weakness and I have anemia. Those are like very straightforward signs. They're already symptoms. Establish that the condition is there. But people who think that they're healthy, they're still semi-sick, but feeling all right. Okay, I feel good. Whatever people say on a day-to-day basis, this is being semi-sick. And at this same time, we may host parasites and not know that, and that can actually go on for years, producing very bad effect on health, causing different slow, low rate flowing conditions. So sluggishness, anemia, chronic deficiency of nutrients, inflammation in different areas and organs. Again, going through the larva stage will show us specific manifestation of different symptoms, organs, and then the intestinal phase will show us the GI manifestation, and general symptoms also be present. And this is how this is the parasite. Respiratory conditions, and then they would have some GI conditions. Let's go on, and we'll talk about Trichinella, another roundworm. This is a microscopic worm, even hardly visible. It is about 2 millimeters, like really tiny, very thin, thread-like coil, but very dangerous. In fact, the smaller, well, I wouldn't diminish the seriousness conditions that are connected to the larger worms, but the smaller the parasites, the severe the cause of the condition may occur. So with this parasite, it happens in a very distinct way. The larva develops inside the muscle tissue, and this parasite affects like most of the mammalians. Any mammalian can be a carrier or the end host. The adult specimen prefers live in the intestinal tract. It bites through the wall. It has mouth apparatus, very strong, with a couple of cuticles around it to protect and to have a harder grasp to the tissue. The female can lay a lot of eggs, and they carried by the bloodstream to different systems and organs. That's how the eggs now travel inside the body, and they get in different systems and lymphatic circulation too. They prefer to develop inside of the muscle tissue, like I already mentioned. They like the strident muscle, and the strident is the diaphragm, the chewing muscles, the eyes, and the heart. So they have their larva phase going in the muscle tissue. They grow to the larger size inside there. And during that stage, person experiences acute muscle ache, muscle pain. If it's in the heart, it can be the heartache. It can give a very specific pain throughout the chest of the heart. So they grow to larva size inside the muscle, and then they can encapsulate with the calcium and stay there in encapsulation state for a long time. And this what happens with the mammals, rats, and pigs, and then their meat becomes infested, and this is how then they get into their end host through the meat of these animals. The severity of the manifestations of the symptoms of the larva stage, the muscle spasm can actually get even to the seizures, choking episodes as well. Well, like I said, the common carriers are the wild carnivorous animals and as well as farm animals. Other signs could also include high fever, long-standing, and which you can hardly break it. The facial edema and the edematous eyeballs and the eyelids, severe muscle pain, and even that can accompany with the seizures. So that's the trichinella. All right, going on to ankylostoma, the worm, how it looks. It has a very sharp teeth inside their mouth that they bite through the mucous membrane easily, and even they can bite through the skin and crawl inside the system. They can live inside the body up to 30 years. This is like unbelievable amount of time. People just feel constantly chronically sick. They forget how it feels to be healthy. These teeth are made of silica. Silica is a very tough mineral that can basically slice through any of the tissue. The females grow to only 18 millimeters, and the males can be up to 11 millimeters. Contamination through unwashed fruit. Ankylostoma is also called necator. Basically, there are two species that are related to each other. If you were to look it up, they'd probably be under the same classification, Ankylostoma and Necator. They may have little differences in their physiological structure, but as far as their parasitic activity, they're very alike, and they have pretty much the same pathway of contamination, and the same way that they infest and cause the health conditions. They bite through the skin. If you walk on barefoot, especially in contaminated places, and even around some warm pools, stagnant pools, ponds, where the larva can be, or the actual worm can penetrate through the skin, they get in the digestive tract and they go into the liver. They love the liver. This is what they are after, causing particular conditions, and they also go into the pancreas, and then we may see the pancreatic manifestation like acute pancreatitis with pain and with the inability to digest, affected GI function, and everything that comes out of it. The larva goes under the skin into the blood, lung, into the airway, and into the larynx. It takes about 1 month to grow to the adult stage, and then they can live up to 5 years in our system. Most of these parasites prefer to live in the small intestine. They also do suck the blood through the intestinal wall. Then everything pretty much the same, the way that they shed the eggs into the external environment and contaminate the soil, and then the cycle begins again. The blood loss can be very considerable during this infestation. One specimen can take about 0.3 milliliters of blood a day, but the total amount of these worms can reach up to 30,000 of these little worms inside the digestive tract. So the total amount of blood loss can also be equal to the one in case of Askari, causing the severe anemia and nutrient deficiency. The inability of our system to build the immune cells and therefore compromise of the immune system is the effect of this infestation, as well as with everything else, other parasites. Coprological tests, they do not show any presence of parasites or the eggs. We can only do the IgG test that can also taken a few times, can show the presence of that. And the fungal and bacterial infections are secondary, but can also reach this severe level. The GI pain can be as acute as during the acute ulcerative colitis or the acute gastritis. So this is the cause of the events that happens with this parasite. Other symptoms can be the edematous areas on the body, vesicles on the skin. It depends on where the point of entrance. Inside the respiratory tract, it can cause pneumonia, tracheitis, hoarseness of the voice, and weakening of the entire system with the same pain and other signs. All right. So next, we begin the tapeworms.
If you find this video helpful, please give it a like, share it with your family and friends, subscribe to our channel, and get notifications. Also, leave a comment of at least 8 words. Comments make difference.